If you tend to worry a lot when there is no reason, you may have generalized anxiety disorder. GAD means that you are worrying constantly and you cannot control the worrying. Healthcare providers diagnose GAD when your worrying happens on most days for a term of 6 months. So today we will discuss GAD. We will talk about its causes, signs, symptoms, and treatments. Hi, my name is Travis. Welcome to my channel. Let's get right into it. Worrying may be something that you're used to. It may be one of them traits that makes you think that's just how you are. Common worries include health, family, money, work, relationships. And while everybody worries about these things once in a while, if you always expect the worst out of these things, it can get in the way of you living a normal life. If you have GAD, you may also have another mental health illness known as depression. So let's take a look at what causes GAD. GAD can occur internally when you can't cope with the daily stressors of life. It also runs in families, but it is not yet understood why some family members get it and some don't. Researchers have shown that areas in the brain that control fear and anxiety are directly involved with GAD. The symptoms of GAD can happen as a side effect of a medicine or of a substance abuse. It can also be related to different medical conditions, such as hyperthyroidism that increase the hormones. This can make the body automatically respond more excitable than usual. GAD can be triggered by family or environmental stress. Chronic illnesses and diseases can also trigger GAD. So what are some of the symptoms of GAD? Some of the symptoms are trouble falling and staying asleep, trembling, twitching, headaches, muscle tension, irritability, sweating, hot flashes, lightheadedness, trouble breathing, nausea, frequent urination, any lumps in the throat, fatigue, poor concentration, being easily startled, and just the inability to be able to just relax. The symptoms of GAD may look like other mental health conditions. If you're unsure about GAD and you don't know whether you have it or someone else, contact your provider. GAD begins gradually, usually at childhood or adolescent age. It can also begin in adulthood too. It is more common in women and it often runs in their families. How is GAD treated? Your healthcare provider will consider your overall health and other factors in advising any treatment towards you. So it's best to get in touch with your healthcare provider and they will lead you on a path of treatment for GAD. Treatments may include medicine, counseling, cognitive behavior, relaxation techniques, working with a therapist to boost coping skills, and any lifestyle changes that can help you. It is important to reduce stress and avoid stimulating substances. Also, seek help to quit smoking if it's something that you do. And of course, don't use drugs and alcohol. Now here's some key points about GAD. GAD is a condition of excessive worrying about daily situations. It lasts longer than 6 months. In addition to feeling worried, you may also feel restlessness, fatigue, trouble concentrating, irritability, increased muscle tension, and trouble sleeping. The best treatment is a combination of both cognitive behavioral therapies, treatment, and medication, both together. Symptoms tend to be chronic but get less severe as a person gets older. So if you or someone you know has GAD and you see some of these symptoms that I talked about in yourself or them other people, get your healthcare provider to take a look at you and get a diagnosis. And then if that is the case, take your treatment from there. GAD is a serious mental illness, and if not treated, it can have dire consequences. If you like anything I said in this video, hit the like button, hit the subscribe button, leave a comment, and the Libra Man is out.